I'm joined by a number of panellists who work across South London. So I'm just going to introduce them before going through the running order for the webinar this evening. The first I'll introduce is Dr. Jackie McLeod, who is a Lewisham GP. Jackie might want to give a wave, an indication of who she is on the screen there. We're also joined by Dr. Simon Parton, who's a Lewisham GP as well. He's got his camera on waving there. Joined by Dr. Chris Ferdinand, who's also a Lewisham GP. Joined by Dr. Di Aitken, who's a South London GP, joining us this evening. Also joined by a member of our South East London Clinical Commissioning Group, Ashley O'Shaughnessy, who's leading on the vaccination rollout in Lewisham, and he's also on camera there for you. Joined by 3 members of our Lewisham Public Health team who are also supporting this webinar. There's Alisa Fannin, Daniel Johnson, and Genesis Adelaide, who you can see on screen now. So if I now just take us through what we're going to be covering during this webinar. So first of all, I will be giving a brief presentation going over many of the facts or factual information about COVID-19 vaccination. I'll then hand over to Dr. Di Aitken, who will give a short account of her experience of vaccination. We'll then move on to that Q&A session that I mentioned. We'll be fielding as many questions as we can get through over a sort of 20 to 25 minute period. So again, as I mentioned, please use the Q&A function. We'll try and get through as many questions as we can. Using the specialist expertise and knowledge of our panel. Can end without saying and encouraging you all to sign up to become a COVID-19 community champion. Again, we'll include the link in the slides that are uploaded. As I mentioned, we have over around 140 COVID-19 community champions, and we're asking champions to be people out and about in our communities who receive accurate information from us around COVID-19 and then pass on to those who they're in contact with. So I'd really encourage you to sign up to become a champion there. We have weekly emails with accurate information around COVID-19 and fortnightly webinars like this on various topics to do with COVID-19 with our champions. Then hand over to Dr. Di Aitken, who I've mentioned is a South London GP who has recently had COVID-19 vaccination and is going to share her experience with us this evening.
Thanks, Catherine. Is the sound coming through okay? Can you, somebody nod? Great, thank you very much. So yes, I'm Di Aitken and I'm a GP, and I'm really happy to be joining my fellow colleagues here to talk about COVID vaccine. You know, we've collaborated on a number of issues over the last few months, but COVID and vaccination has really been the big one that we've. I went along to our GP-run vaccination centre, and so when I went, it was very well organised. They checked my temperature before I was even allowed in the building. And then the whole process was socially distanced with lots of checking to check that I felt okay and that I hadn't been in contact with anybody with COVID in the last 7 days. And I didn't feel unwell myself. The actual injection itself was so simple. It's just a very fine needle. It's just like having a flu jab. It's the same kind of size needle that's used for baby injections, actually. So there's nothing special about having the vaccination. And then you have to wait 15 minutes afterwards just to check that you don't have any of the rare reactions that Catherine talked about. And because it was a GP-run centre, I knew lots of people, so I just spent my time chatting. But other people were sitting around, relaxing in armchairs and flicking through their phone, basically, because we weren't allowed to put out any reading material, apparently, because of infection prevention control. But people were just sitting around reading their phone. And after that, an hour later, I took off my plaster. I didn't really need one, and things were fine. Looking at that list of possible side effects that Catherine had put up, I was on the lucky side. I know people who've had their vaccination and did feel a bit fluey. My arm was just, it wasn't even painful, but it was tender if I pressed it. And so I think I was definitely on the lucky one. The worst side effect I've heard of is feeling a bit fluey for a day or two. It's usually overnight. So I've known 2 people that have had that kind of reaction. But for any conspiracy theorists out there, I have had my vaccine. And yeah, I think that's about all I have to say, really. I identify as Black British. I'm of Jamaican heritage. And, you know, I wouldn't have had this vaccine if I didn't think it was safe. You know, I'm somebody one of my roles is the clinical effectiveness lead for South East London. So I've done all the reading about the vaccine, and I definitely wouldn't have had it if I didn't think it was safe. And that was my motivation for doing the social media videos, to try and encourage more people from the Black, African and minority ethnic communities to
just to introduce myself, I am a GP in Lewisham, but I also my practice has already delivered 2,500 COVID vaccinations so far since December, and so we are quite experienced in this. The vaccines themselves are new, and what that means is that they are a bit tricky to handle, and that's why we haven't been able to get out to our housebound patients yet. But I'm very pleased to say that the AstraZeneca vaccine, which was approved more recently, just at the beginning of January, that's the one which is able to be moved between people's homes. And actually, the information just came out today, telling everybody across the country about how we can do that safely. So how we can do that to make sure that the vaccine, when it gets to our patients who are in their homes, is still safe and effective for them to have. So that information's out today. So hopefully we'll be seeing those who are housebound getting vaccinated. That should start in the next week or two. You need to be aware that that's a large group of patients. For my group of practices alone, that's nearly 400 individuals. And obviously it does take time to go from house to house to deliver the vaccine. We reckon sort of 20 to 30 minutes per patient. So that will slow us down a little bit, but the intention is absolutely to get them all done as quickly as possible.
If I can then move on to another question. This one has come in to say, how many vaccination centres do we have in Lewisham? And I don't know if I should call on Ashley from the CCG to respond to that one, if possible.
Yeah, that's fine. Thank you, Catherine. So at the moment, as Catherine described, we've got a variety of different options. The option, I guess, that we've got most local control over is are the sites that are being run by our groups of practices or primary care networks, and we've got 5 sites currently across Lewisham. So just to very quickly run through them, we've got the Waldron Health Centre in the north of Lewisham, up by New Cross Station, and that's predominantly obviously serving the patients in that area of Lewisham. But also we're using that to serve our patients in the Lee, Green and Blackheath area. We did look at some more local estate to that area, but there wasn't anything suitable. So what we've agreed is that those patients will make use of the Waldron Health Centre. People who know it, it's obviously a very big purpose-built health centre, so it's got a lot of space to safely accommodate large numbers of patients. So we've got 2 kind of groupings of practices, one running from the Waldron Health Centre. Then, as Dr. Ferdinand said, our second site is the St John's Medical Centre, just up the road from Lewisham Station, which is serving kind of the group of practices in the middle of the borough. And then moving into the south, we've got a site at the Downham Health and Leisure Centre for our Grove Park and Downham residents, and then moving across to the west of the borough, the Jenner Health Centre, and then the Sydenham Green Group practice. So I think the important message is obviously those are sites that are running. They're not walk-in sites. So just to reinforce that important message that Catherine gave, patients will be invited to book in to those clinics. So those are the local clinics. And then, as we said, there are other options coming on stream. So some bigger mass vaccination sites. I'm sure people will have seen the Excel Centre, which has just gone live in East London. And further discussions are going on around what that might mean for some venues slightly closer to us in South East London. So nothing confirmed at this stage, but conversations are ongoing. And similarly around community pharmacists, our first community pharmacist is due to go live on Monday. And again, for those mass vaccination sites and the community pharmacy sites, they won't be walk-in sites. There'll be patients will be invited to book into those.
Thank you. Then if I can move on to another question that's come through. This is from somebody who works in a Chinese community centre, where there are many elderly Chinese attendees who do not speak English. So this is a question really about translation services, and will there be anyone to support them when they are contacted?
Certainly all practices across Lewisham have access to, well, in fact, South East London, translation services, which are easy to schedule and a three-way conversation can be had on the telephone with
around how people are being invited for vaccine in Lewisham, and any reassurance to give around preventing any scam operators around vaccination at the moment. Any panelists like to come in on that? So Ashley, you'd like to come in?
So I'm happy to start on that. Then Dr. Ferdinand may want to come in, who's obviously been directly involved in the process. So at the moment, we're getting quite short notice on deliveries coming in, particularly into the practice sites. I think people have put in the question and answer box. We know there are issues with the post in Lewisham at the moment. So I think the reality is at the moment, most of the invites are going out either by text, where we do hold mobile phone numbers, but that is also absolutely being backed up by telephone calls as well. So we're not relying on the postal system. And as I said, with the short notice timeframe that we have got available, looking at kind of text messages where that works for people, and if not, then supplementing that by phone calls. As I did say, in terms of the different delivery models that are starting to come online, we do know that some patients are now receiving letters that are being sent nationally. So we're not sending those locally, they're coming out nationally, and they will be inviting patients into some of those, as I said, those other, so the mass vaccination sites and the pharmacy sites. So I think at the moment it is a bit of a mixed model. Some patients will be contacted by text, some by phone, some by post, and unfortunately some patients may get contacted more than once. And even after they've had the vaccination, they may get contacted again. So can only apologise for that, but hope that kind of provides an explanation around the different models and why patients might get contacted more than once. And obviously, if you've had the vaccination, then you don't need to go and have another one. Obviously, you need to come back for the second dose at the right time. But yeah, please, obviously, where you've had that first vaccination, that they will then recall you for your second vaccination. And yeah, as I said, just an apology, because I know it is going to be quite confusing, and we'll do everything we can locally to clarify the messages around that.
Is there any documentation that goes along with the vaccination to prove a person has had it? And this is in relation to the requirement to provide proof of vaccination in future. So any panelists like to comment on the records given? Dr. Aiken.
So I can tell you about my experience, which wasn't in Lewisham. I was given some really good information leaflets, and then also a little card that was completed with my name, date of birth, the date of the vaccination, and the batch number. So that is for me to keep.
Yeah, I think the only thing I'll just add to that is all vaccinations will be sent back to patients' own GP and will be coded in their record. So that will be the other kind of source of recording that vaccination has taken place, which obviously will be clear, when that was done. And as Jackie said, then that can then be used as a mechanism to make sure we're calling patients for the second dose. So as well as that kind of physical card that people will have, it will be hard coded into the patient's
effectively from when you had your first dose. If you have your first dose, you just count forward 12 weeks back to the date by which you should have your second dose. And so if you haven't heard from your practice by the time that second dose is due, please get in touch with them, and I'm sure they'll make sure that hopefully they will be in touch with you. I fully intend to be in touch with my patients for their second dose.
So I don't know if any panelists would like to add a final comment just on the effectiveness against the new strain, before I have some closing.
Thank you, Catherine. Comments. So yes, I think that there is certainly no evidence published through research at the moment thus far that the current vaccines that we have, that we're using in the UK, so Pfizer and AstraZeneca, don't provide protection against the new strains that we're hearing about in the press. So I would encourage people to continue to vaccinate with our current vaccines that are available, and to let's maximise the uptake across London, across Lewisham, but we have no information to say that there is less effectiveness against those strains. A huge thank you to all of you. Keep your distancing, wash your hands, take care, and take up the vaccine